The NHS is the government's topic of the week, and it's nice to see us focusing on reform and policy as opposed to just talking about how everything's getting worse. Prime Minister Keir Starmer has declared a once-in-a-generation opportunity for the NHS to be reformed, and that's great. But the way that they've gone about it has struck us as being a little strange.
Yeah, so on Monday, the Health Secretary, Wes Streeting, announced an open public consultation on the future of the NHS. And in the grand tradition, it makes you so patriotic, things got very weird.
Yes, I mean, in something that any of us could have seen happening, the proposals that were coming in thick and fast were different flavours of nonsense. One of them included putting beer on tap in hospitals, free cinema tickets from the NHS, waffles for every meal, just some of the highlights from day one of the consultation. Development of an alchemical panacea is an incredible piece of policy. I'm not sure anybody would get behind the proposal for mandatory euthanasia to fill up hospital beds, but the suggestion to legalise recreational cannabis might make Coco happy.
This is ridiculous. You do this every opportunity you can. Just make some little dig about some false accusation about me and potential recreational drug use. It's just utterly absurd. I would never take recreational cannabis, not least because it makes me sick. Obviously, there's plenty
That's right. In fairness, I've never seen you taking cannabis. And that's the end of that sentence. That's the end of that sentence.
That's the end of it. Isn't making stuff up fun? So obviously, there's plenty of actual productive suggestions too. Some of the comments that have come in include clean the hospitals now and then, better healthcare, which is, certainly one we could agree with, as well as maybe actually providing some healthcare to trans people.
An actual good suggestion. This is obviously the NHS's Boaty McBoatface moment. Now, again, I suspect most of you will be familiar with this. If there are any international listeners or viewers that don't remember this, there was a public vote on naming a new boat, and the winner was Boaty McBoatface, because the British public cannot be trusted to not play the fool. So look, I think there's definitely an argument to be made that it is a good thing that reforms of the NHS start by a consultation with the public who use it. There will be people listening to this and watching this that will have very specific experiences of the NHS that they think would be useful for the government to hear in terms of improving the situation and outcomes for patients. The only thing that strikes me as strange about this is I don't really understand why we're not talking about the rollout of the Labour Party's plan for the NHS that it'd been building up in its period in opposition. I'm slightly concerned as to why there was no specific plan for day one of a Labour government and what it would do to start to deal with some of the problems in the National Health Service.
Well, exactly. It is important that patients have an opportunity to speak about their experience, and more information is good. But I would be surprised if there wasn't already a wealth of patient data out there and there was already stuff that they could be working on to, stop this acute problem that's going to happen in winter, because that's what people want.
So the first solution I would have thought is an immediate cash injection into the National Health Service. And the idea that we're starting from a position of, okay, we need to make a list of everything that's wrong.
Yeah, it's like a fact-finding mission.
It's deeply concerning because when does that actually translate to policy? And when does that actually translate to money going into the service? We all know the key problem.
Yeah.
I can't imagine how many of those public consultations are, we need more money, our hospital doesn't work, we can't get an appointment with our GP. You have to do something in the short term to fix a crisis.
Well, I don't think it's unreasonable for us as citizens, as voters, to expect that there was already a robust plan in place.